Up next, a cure for the common snore, how laser technology is making a peaceful night's sleep easier than ever. The time now is 7:18, and in this morning's medical alert, if you or your husband snore, your dentist may be able to help. And joining me now is Dr. Steve Pohlhaus with the American Academy of Sleep Medicine. Good morning.
Good morning. How are you?
Thanks for being here.
Thank you.
A lot of people maybe woke up because their spouse or significant other was snoring.
Sure.
You're saying there's a difference between snoring and sleep apnea.
Yeah, snoring is just the noise that our airway makes as it closes down a little bit, but we're still breathing just fine. Sleep apnea is when the airway actually closes and we don't breathe in our sleep. So it's a much more severe medical condition.
And obviously nobody wants to hear somebody else snore, so there are some ways to treat this.
Yes. There's different things that can be done for patients with sleep apnea. There's the CPAP machine, which many people are familiar with, which actually blows air into your nose at night. The main problem with this is a lot of patients don't tolerate it. And there's another option that your dentist can make called an oral appliance therapy, which looks like this.
It looks like Invisalign almost.
It's basically like two Invisalign retainers with a strap on it, and that pulls the jaw forward, and that works much like during CPR when they do a chin lift to pull the jaw forward to open the airway. And it's quite effective for both snoring and sleep apnea.
Wow, such a small thing, but can make big changes.
Very
you were
much.
also telling me about laser technology.
Yes, there's a newer technique called night lace by a company called Fotona that I've been doing in my office for the last 2 years. It originally came from Europe. It's a very simple procedure. There's no anesthesia. It's done in about 20 minutes, and it takes 3 sessions. And basically, we apply laser light to the soft palate and surrounding structures. And what that does is it firms the collagen in the tissues, so the tissues are firmer and less likely to collapse at night and make the noise. It's based on well-known plastic surgery techniques for treating wrinkles and such on the outside of the face for many years, and we're just applying it in the mouth.
Multi-use, we like that.
Yes, very much so. Yes.
All right, well, thank you so much for coming in. Great information. You can always check out the dentist if you need to check out snoring.
Absolutely.
Thank you for being here, and don't go away.